Mrs. Ruth has often fallen out of bed and bitten off her intravenous line. She is given a sedative by the nurse. What sort of limitation is this? A. Use of physical force. B. Sustainability. C. Medical limitations. D. Chemical restraint. Contusion refers to A. An open cut caused by something sharp. B. An exposed wound with sharp edges and torn tissue. C. A different term for concussion. D. A closed wound from a physical hit. Following surgery, the following two primary respiratory problems can occur. A. Bronchitis and pneumonia. B. Pneumothorax and bronchitis. C. Asthma and pneumonia. D. Atelectasis and pneumonia. When a clot of blood, air, or fat passes through the circulatory system and eventually lodges in a blood artery far away, it is referred to as A. Embolus. B. Anesthesia. C. Enema. D. Thrombus. There is a pneumothorax in a customer. Here is the collection of A. In the pleural space, blood. B. Breathing secretions within the pleural cavity. C. Air within the pleural space. D. In the pleural space, fluid. All ages of adults frequently fear A. Afterlife. B. The 5 grieving phases. C. Prior instructions. D. Dying by yourself.
Following surgery, Mr. John needs to practice deep breathing and coughing in order to avoid
A.
an embolus in the lung.
B.
Anguish and distress.
C.
Swelling.
D.
Respiratory complications.
Watery, clear discharge from a wound. This drain is known as A. Drainage of the seropurulent. B. Discharge from serosanguineous. C. Serous drainage. D. Sanitized drainage. The bacterium responsible for colitis and diarrhea is known as A. VRE. B. Hepatitis. C. Difficile. D. ESBL. AIDS is an acronym for A. Animal immune deficiency syndrome. B. Anginal immune deficiency syndrome. C. Alienated immune deficiency syndrome. D. Acquired immune deficiency syndrome. Except for the following, all of the phrases indicate peeing. A. Micturition. B. Impaction. C. Passing through. D. Taking a urinal. Which type of workplace could offer acute care? A. Long-term care establishments. B. In-home care. C. Hospitals. D. Facilities for assisted living. What is the incorrect claim regarding the Canadian Charter of Rights and Freedoms? A. It safeguards Canadians' equality before the law and in other contexts. B. It defends the freedom and expression of Canadians. C. It is not applicable on a provincial level. D. The Canadian Constitution contains it. Which is untrue? A. Prejudice is acceptable under some circumstances. B. Discrimination typically results from prejudice. C. Stereotypes and bias are frequently linked. D. A prejudiced attitude evaluates individuals depending on their affiliation with a certain group. Regarding chronic sickness, which of the following is false? A. Frequently, the symptoms develop gradually. B. People typically get better. C. The sickness progresses slowly. D. It could lead to a mental or physical impairment. Among the support services offered by home care are not: A. Help with household management. B. Self-care. C. Support for everyday living activities. D. Respiratory therapy. Which is untrue? A. A country has a single ethnic group. B. Individuals that belong to an ethnic community frequently identify with one another and have similar histories. C. Race is a group of people with comparable physical characteristics. D. Health and disease practices are influenced by an individual's culture. The primary driver behind healthcare reform has been: A. Absence of accessible technology. B. Growing prices for services, medications, and technology. C. Insufficient accessibility. D. The downturn. Which statement below is untrue? Individuals in good emotional health. A. Understand their own advantages and disadvantages. B. Display self-control. C. Easily express their emotions. D. Have a strong sense of self. The deliberate attempt or threat to enter someone else's space and touch them without their permission. A. Battery. B. Defamation. C. False imprisonment. D. Assault. Personal support worker, compassionate care guide. A personal support worker is a dedicated caregiver who plays a vital role in providing compassionate care and support to individuals in need. Whether they are assisting older adults, individuals with disabilities, or those who require additional support at home, PSWs are valued members of the healthcare team. As a healthcare worker, a PSW is responsible for ensuring the well-being and comfort of their clients. PSWs provide a wide range of assistance, including help with personal hygiene, medication management, mobility support, and emotional well-being. Their commitment to empathy and understanding allows them to build trusting relationships with their clients, ensuring that each individual receives the personalized care they deserve.